Okay, so now we're going to talk about anti-manic drugs. So the gold standard is lithium. It's absorbed in the GI tract, excreted in the kidneys, and has a half-life of 24 hours. The therapeutic index is between zero point 0.6 and 1.0 milliequivalents per liter. It's used alone or in combination. Bipolar, meaning two poles, is that it treats dysphoria or depression, euphoria or mania. Overarching treatment issues is getting the acute mania under control. You want to prevent relapse when remission occurs, and you want to return them to their prior level of functioning interpersonally, occupationally, and socially. So the treatment goals would be remission, prevention, and returning them to their premorbid function. Maintenance therapy would be preventing relapse, reducing risk of suicide, improving their function, and reducing the subthreshold symptoms. And these are symptoms that are not quite reaching the level of clinical diagnostic significance. So the gold standard is lithium. Its naturally occurring element is salt, and treatment and prophylaxis of manic phase. So some pharmacological effects is that it inhibits the release of norepinephrine, serotonin, and dopamine. It also facilitates their reuptake into presynaptic terminals, which means decreasing the presynaptic levels of these neurotransmitters. The very action you would surmise need to occur in the hyperactive state of mania. It also normalizes a dysfunctional second messenger system. And its pharmacokinetics, again, is the peak level is 1 to 3 hours, absorbed in the GI tract, excreted in the kidneys, and its half-life is 24 hours. Now I'll give you a second to read about Robert. And another second to read the question. So the correct answer is C. In bipolar disorder, the sodium accumulates. It diminishes the hyperpolarizing functions of the inhibitory neurotransmitters. The neurons fire more easily, but with loss of amplitude. And this causes calcium channels to decrease activity, resulting in a reduced neurotransmitter release. Some guidelines for the patients taking lithium. You want to be sure they take it at the same time every day. Let them know that the mild effects are transient. You want them to report any vomiting, coarse hand tremors, sedation, weakness, or vertigo. You want to be sure they maintain their salt intake and have a balanced diet. If they have an illness with fever or excessive sweating, it may require a dose change. And their morning blood draw should be 8 to 12 hours after their last dose. Some common side effects would be nausea, dry mouth, diarrhea, thirst, drowsiness, and mild hand tremor. They also may experience polyuria or polydipsia, and that occurs in 70% of the patients. They may experience weight gain or a bloating feeling, sleepiness, and lightheadedness. Toxic effects. So there's 3 levels of toxic effects. The first is mild to moderate, which would be their lithium levels would be 1.5 to 2.0, and they would experience diarrhea, vomiting, drowsiness, dizziness. They'll have a coarse hand tremor, muscle weakness, lack of coordination, or a dry mouth. With the moderate to severe, their levels would be 2 to 3 milliequivalents per liter. And they'll have all of the previous symptoms, but they'll also experience ataxia, giddiness, tinnitus, or ringing in the ears. They could experience blurred vision, large output of diluted urine, delirium, or nystagmus. Severe toxicity is greater than 3.3 milliequivalents, and they'll have, again, the same previous symptoms in the mild to moderate and the moderate to severe, but they can also experience organ failure, renal failure, coma, or death. So some key nursing interventions, you want to make sure you discuss the side effects that the side effects should subside. And you want to identify the side effects that require immediate notification to their doctor, which would be the vomiting, severe tremor, sedation, muscle weakness, or vertigo. You also want to suggest that they take their lithium with meals to reduce the nausea. It's recommended that they drink at least 10 to 12 glasses of water per day. You should also advise them to elevate their feet to reduce any ankle edema. And you want to advise them that consistent sodium intake is important because the increased sodium is a major increase in perspiration when it occurs. I'll give you another second to continue reading about Robert. And another second to read the question. And the correct answer would be C. Normally, while taking lithium, the patient is to reduce their intake of salt, but if they're sweating heavily, it's important to increase his salt intake during this time. So some anticonvulsants are also used to treat Depakote, and the therapeutic level would be 50 to 100. And some other anticonvulsants would be valproates, Tegretol, Lamictal, Trileptal, Neurontin, or Topamax. So how valproates work? What they do is they increase the inhibitory role of GABA. They suppress sodium influx into the neuron, and they also suppress calcium influx through specific calcium channels. Some atypical antipsychotics that can also be used would be Zyprexa, Risperidol, Seroquel, Geodon, Clozaril, Abilify, or Safras. And I'll see you for the next lesson on therapeutic